Hello again, this is Dr. Fatma Qureshi. Today I was thinking let's talk about SPK, which is superficial punctate keratitis. It comes under the category of dry eyes because my patients will just come to the exam room in pain, in discomfort, and they have this sandy, gritty sensation in their eyes. They're thinking it's dry eyes or it's itching and watering. So if it's itching and watering, it's going to be allergies. If it's just sandy, gritty sensation, and even with excessive tears, it's going to be dry eyes. Now, the dry eyes could be secondary dry eyes, as I have mentioned in some other videos, but today I want to focus on primarily SPK, which is superficial punctate keratitis, which is inflammation of the cornea. And I'm going to show you some pictures of that today as well. But going back to the secondary dry eyes, if you have excessive tearing, that means that the eyes were dry. The signal goes to the brain sends the signal back to the cornea through one of the branches of the trigeminal nerve, which is the fifth cranial nerve that has three major branches, and one branch has other sub-branches, and one of the branches does go to the eye. So remember, the trigeminal nerve is here, and it provides some branches to the eye, to this part of the face, and also to the lower part of the face. And I have mentioned that in, I believe, my herpetic keratitis video, talked in detail about how the trigeminal nerve works and how its branches are distributed. So that's the anatomy part of that. So anyhow, going back to excessive tearing, the signal comes back from the brain to the cornea, and the cornea gets that signal. There are lacrimal glands in the anatomical part of the human eye which make more tears in order to keep the cornea lubricated. So that's our natural defense mechanism. But that doesn't mean that you don't have dry eyes, because that's counterintuitive. I understand that. But patients need to understand that is secondary dry eye. So that means that we need to still treat the root cause of the problem, which is dry eyes. So now I'm going to talk about the SPK, which stands for superficial punctate keratitis. Does it go away on its own? Well, it depends. If it's very minor, mild to moderate, then probably it's not going to cause that many issues to you or in your eyes. But if it's severe SPK, severe superficial punctate keratitis, absolutely you need treatment. You just don't need over-the-counter eye drops for that. So Refresh and Sustain are very good drops. I agree. I recommend that. Over-the-counter drops are very good for mild dry eyes. But if you have superficial punctate keratitis, which means there's inflammation going on, because remember the word itis, anything that ends in itis means there's inflammation. And if it's severe, it's not going to go away on its own. So that's why I have made these videos. You can find these conditions under my dry eyes playlist. And also remember, I used to do these amniotic membrane grafts, and I would make these videos. I made these videos especially because for you guys to understand there are so many treatment options when it comes to severe dry eyes involving inflammation, involving SPK, keratitis. I can do amniotic membrane grafts. I can still do them. I haven't done them recently for whatever rhyme or reason. But yeah, the amniotic membranes are the membranes that cover the cornea, and they start healing the cornea in the form if there is a lot of SPK or inflammation going on. So superficial punctate keratitis requires treatment in the form of prescription medicine, eye drops. My personal favorite is Pred Forte, which is prednisolone acetate 1%. And I have given so many prescriptions, written so many prescriptions for Pred Forte that I remember there was a pharmacist in my town who once told me, Doc, I have got so much of Pred Forte for you because I know you write that prescription so much. So anyhow, that's Pred Forte 1%. I do prescribe that on a tapering schedule. Normally I start, and I think I've mentioned it somewhere else in some video, but I start with, depending on severity of the condition, but normally I would say 4 times a day for 2 weeks, then third week 2 times a day, and final week once a day. So I taper it from 4 to 1. Why do we taper steroids? Because they can cause complications or side effects. If they're not tapered, the intraocular pressure, eye pressure, can increase also. Long-term oral steroid use or IV steroids obviously can cause more serious problems in the form of cataracts and blood glucose going high, but we're not worried about that. We're just talking about topical application in the form of eye drops. So now I'm going to show you some pictures because I like photos because they explain things much extensively, and patients tend to understand and remember things. So remember, the cornea is supposed to be very clear, but if you look at this photo where I have pointed with my pen, you're going to see that there is this cornea, and I put the fluorescein. This is just a picture obviously that I got, like a random picture. It's not on one of my patients, but if you see, the cornea has all the staining going on here, and that is classic superficial punctate keratitis. The staining is done with the fluorescein strip, which is yellow dye, and then we have the blue light from the slit lamp, and it shows this pattern. If the staining is showing like this, that means it's inflamed. This one is really bad. You can see all of these yellow tiny dots showing here. This is very bad SPK. I'm trying to find more pictures. This is another superficial punctate keratitis. So there are different patterns that appear on the cornea. If I don't stain the cornea, obviously I won't be able to see them that well. But I'm just trying to get you an idea of what the SPK looks like. This is how the cornea looks without the stain. I'm trying to bring this camera here. So if you look at this one, when the cornea is not stained, or when the blue light is not shining on the cornea, this is what the SPK would look like. So the cornea is supposed to be transparent, and the pattern, you can see the pattern even before staining, but obviously with the staining, you can see the pattern really clearly. So this is SPK. Okay, so that's about the SPK, and I also say to my patients, inflammation, like I said, is not going to go away on its own. So what do? You make an appointment, come see the doctor, let us treat you, and let us see you back for a follow-up. Because if I don't do a follow-up, how am I going to know if it's going away? Is it improving? If it's stable? If it's getting worse? Like, you need an appointment for that. So patients are relatively very good about that. They come back for the follow-up, and then I can do a full eye exam on them later with the dilation and all. I'm trying to think if there's anything else I need to tell you about SPK, because patients like to watch my videos and then they say, well, instead of watching someone else's video, we want to watch yours because we want to hear from our own doctor. And that's how this educational channel started. I remember there were some patients who were asking me to make videos to educate them, and I would always say, oh well, I don't have time, oh well, who's going to do it, blah blah blah. But then they would say, doc, you're good, you can talk fast, which is, I don't think is good, because I don't like talking too fast. It's not going to help my patients. But anyhow, I'm just saying that sometimes it's important to get that comfort level from your own doctor, so that when your doctor is saying something, you understand it better, obviously, and then you follow the instructions and the directions. So anyhow, that's how the channel started, and that's why I wanted to make this particular video, because these days I'm getting a lot of dry eye cases. I even posted something on my public page on Facebook. So patients, when they send me messages or they ask me questions in the exam room, or their friends or relatives or whoever, then I said to myself, maybe it's time to make a particular video focused primarily on superficial punctate keratitis, even though I've talked about it in general terms in my dry eye video series, but I thought this was the perfect time to make a video especially on SPK. So remember, superficial punctate keratitis, you're going to have some kind of discomfort, some kind of pain. You're going to have, you could have tearing, you could have some kind of like foreign body sensation also in your eyes, and you could have photosensitivity also. If the SPK or keratitis or inflammation is really on the central part of the cornea, then you can also have some decrease in vision as well. So you need to come to your doctor, let us put the dye, the fluorescein strip dye on the cornea, let us see the pattern, and let us treat it accordingly. Along with the Pred Forte, I sometimes also prescribe other prescription dry eye drops such as Sequa or Restasis. It depends. And then I also, because the steroid, you cannot use the steroid forever, right? And not for a long period of time. But you can use artificial tears along with Cequa or Restasis, which are prescription drops for dry eyes, for long term. And then the steroid would be for short time period. So once it starts improving, then I tape, after even tapering the steroid, then I put them back on their dry eye drops. Okay, so any questions that you have regarding this topic, feel free to ask me in the section where you can ask questions, and you can ask questions on my public page on Facebook as well as on YouTube. Thank you. Have a good one. Bye bye.